Here we are looking at the MEN syndrome. So to begin with a few questions. The first question being, in case of the MEN 1 syndrome, what are the characteristic tumors? Next one being, in case of MEN 2B, what are the associated tumors? And next, in case of the MEN 4, what are the associated conditions? So by the end of the video, we'll be discussing all the answers. So now going with the MEN 1 in detail. So the MEN 1 syndrome. So it is about the chromosome 11q13 as well as the MEN 1 gene. And aka it is also known as the Wermer syndrome. So what are the characteristic tumors seen? The characteristic tumors, it includes firstly the parathyroid. So it includes the parathyroid adenoma. And this is about 90% and it is the most common overall. Next, also in case of the enteropancreatic tumors. So here it is most common. Most common functioning tumor, it is the gastrinoma. And the most common site is the duodenum. Next, we move on to the associated tumors. So the associated tumors, this includes there's angiofibroma. Next, there is the cholangiomas, adrenal cortical tumors. Next, we have the lipoma, neuroendocrine tumors. This includes the gastric, thymic, as well as the lungs. Then we have the meningioma. Then the pheochromocytoma, as well as the carcinoid tumors, which is usually in the foregut. Next, what we do is we jump onto the MEN 2. So the MEN 2 syndrome features, firstly we look at A and B. So the MEN 2A is also known as aka Sippel syndrome. Sippel syndrome, and this is of the chromosome 10 as well as the RET gene. Then looking at the associated conditions, it includes the MTC, that is a medullary thyroid carcinoma, and this is about 90% important. And then looking at the pheochromocytoma. This pheochromocytoma, this is about greater than 50%. Then is a parathyroid carcinoma. This is say about 20%. Then we focus on the MEN 2B. So the MEN 2B is commonly known as the MEN 3. And what is the chromosome involved? It is chromosome 10 as well as the RET gene. So what are the conditions associated with the MEN 2B? So looking at the conditions, it includes the medullary thyroid carcinoma. This is above the 90%. And next is the pheochromocytoma. And this is above 50%. And next, what are the associated conditions? So the associated conditions, it includes, and this is roughly around 50%. It includes the mucosal neuromas, then the marfanoid habitus, then the medullated corneal nerve fibers, as well as the megacolon. Lastly, we look at the MEN4. So in case of the MEN4 features, so it is associated with the CDKN1B gene. So where is this gene present? In the chromosome 12. Associated conditions, it includes the parathyroid adenoma. Next, it also includes the reproductive organ tumor, and this is like the testicular cancer as well as the neuroendocrine cervical carcinoma. Next, also in case of the adrenal and the renal tumors. Now, to answer the questions we initially asked, so what are the associated tumors with the MEN1 syndrome? So the question was the characteristic tumors. So characteristic tumors, it included the parathyroid adenoma. Next, it also included the enteropancreatic tumors. So the most common we saw was the gastrinoma. Then there is also the pituitary adenoma. The next question, it was the characteristics of the associated conditions with the MEN2B. So here in case of MEN2B, there is the medullary thyroid carcinoma. We saw it is greater than 90%. And then the pheochromocytoma. This was greater than 50%. And other conditions which roughly totally accumulate to about 50%. So this is, it includes the mucosal neuromas, then the marfanoid habitus. Next, the medullated corneal nerve fibers as well as the megacolon. So lastly, the last question we asked was, what is the associated conditions in case of MEN4? So here, associated conditions, it includes the parathyroid adenoma. Next, it includes the pituitary adenoma. Then the reproductive organ tumors like the testicular cancer as well as the neuroendocrine cervical cancer. Next, also the adrenal as well as the renal tumors.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.